Hello, how you guys doing again? This is Maggie, Nurse Maggie from Florida, and today I have some information on chronic pain. As you know, as a nurse, I've seen a lot of patients living with chronic pain. I myself had have suffered from chronic pain in the past, and I have 5 tips that I would like to give you all to leave you with today that you can talk to your doctors about. Make sure that you understand how you can advocate for yourself. Again, advocacy for self care is very important, especially in today's environment where we have a lot of information, especially on the web, online. But you have to be aware to bring these um, options to your primary care physician, to your doctors, and they can help you make the best decision. Okay. So for me, I would say that the first thing, if you're suffering from chronic pain like arthritis, fibromyalgia, you have or any accidents or injuries um, that you're prone to, there are things that you can do to help manage chronic pain. Well, number one, of course, is to collaborate with your healthcare doctor team. Whoever it is that you reported your pain to, it has to be reported. The doctors have to, you know, treat your pain and with imaging such as x-rays, ultrasounds, whatever that they need to make the best informed decision for to treat you with. And then, of course, working along with your primary care, there's a physical therapist that can help. There's other orthopedic doctors that can also get on board if you suffer from fibromyalgia, rheumatoid arthritis, autoimmune conditions. There's also specialists, the rheumatoid specialists that can help you. I mean to say rheumatologists that can also help ease the impact of your pain. Um, I think the best way to determine if you are getting better from your condition is to see how your quality of life is improved by the treatment that you and your doctors implement for you at the time. So keep that in mind that your options should always lead you to, am I getting better? Am I having better quality of life? Am I able to get out of bed today, or walk a little bit better with physical therapy, with orthopedic specialty, rheumatologist, primary care physician on board, pain management on board? What is happening? If you are not getting better or you see no improvement, definitely talk to your doctors and find out, what other treatment methods they have available for you. Never give up hope. Number one, do not give up hope. There are so many methods and in pain management methods out there that you just need to bring it to your doctor's attention that, hey, I've noticed I've been on this, medication for the longest time, or we've been doing physical therapy for a while and it's not helping, and they will help you. Okay, find other alternatives. So number two, I would say there are multi methods to treating pain. So, for example, you can combine medications over the counter. Um, that is, if it's okay from your primary care physician standpoint. There's also cold therapy. Some people prefer cold therapy. Some people prefer warm, like a warm compress, where some people prefer an ice pack. So it's up to you to determine which makes you feel better in the long run. Primary care physicians may send you to physical therapy. They may give you like a TENS unit that it helps transcutaneous electrical nerve stimulation, which can help with pain, especially if it's numbness, tingling, um, anything like stiffness or joint aches. Muscle rubs are always great. I always recommend, to speak to your doctor about icy hot, Voltaren gel, all of those things that can help with you massage at the end of the day. Get you after you take a warm bath. If it's a cold bath, a cold compress, warm compress. You can do a massage. You could apply your ointments. All those things are helpful to you when it comes to pain. Number three, excuse me, I would incorporate physical activities as tolerated and if is approved by your doctors. Especially if you have like a severe spine injury, you don't want to start exercising, lifting, or anything like that. You want to make sure your doctors are telling you how you can advance your exercising, but you would want to always start slow and start with light exercises like stretching, walking, maybe some acrobatic therapy, swimming. It helps reduce stiffness and also improve circulation. So just a light yoga. You could do stretching exercises in a chair. Nothing to just to see how you're feeling, and then advance it as you can tolerate. Okay. Then the next one is, of course, physical therapy. That's with guidance from them. They usually send you home with a list of therapy that you want to do. So you want to follow that, and it helps build your muscle strength and reduce pain. Of course, do proper techniques. If you don't know, um, don't try an exercise if you weren't explained by physical therapy. Make sure you ask them. That will help prevent injuries. Okay. Next, fourth one is to balance rest and activity. Very important to avoid overexertion. Okay. You don't want to push yourself too fast, too far. Try to rest the joint, rest the body, especially if you have fibromyalgia, um, chronic fatigue, or rheumatoid arthritis. You want to make sure you get plenty of rest and do light stretching, light exercises before you want to advance. And some days you might do better than others. It's not every day you're going to have achieved progress. Some days you might find yourself a little bit more tired, more painful, but try again the next day to see if you're getting better results. And of course, pacing yourself is very important. You don't want to have pain, chronic back pain, and then every day you get up and clean the house, you move boxes. That's not going to help. You'd have to pace your activities to know there is some days I'm able to do certain things and some days I'm not. When to ask for help, when to hire someone, when to be able to know that I can do some yard work today because I'm feeling better, or I'm not going to do anything today. I'm going to take a rest. Okay. So make sure you know what your body's asking you. Okay. The next one is fifth one is to do mind and body exercises, meaning strategies to practice mindfulness, mind relaxation, having relaxation techniques on board, like deep breathing, imaging, progressive muscle relaxation methods. These can be discussed with your primary care physician or your physical therapist as well. Biofeedback is one of the important strategy for mind and body healing, where your primary care physician can again send you to get biofeedback, which can help you gain control of the physical responses to pain. Okay, physiological response to pain. And then number six, I'll give you my sixth one, which is my extra tip, is to nutrition. Nutrition is very big on healing. Okay, having nutrition that is anti-inflammatory is very important, especially for joint pain. Pay attention to what you eat and when you'll have pain flare-ups. I would recommend, keeping a journal of the food that you eat. And for example, I myself, if I eat a lot of peanut butter, my joints would become inflamed. So I know this about me after I journal many times that after I've eaten this, peanut butter, I started having more pain. So pay attention to what you eat. Of course, medical research recommend fruits, vegetables, lean protein, omega 3s, fatty acids. All of these is healthy nutrition for your joint, and it will also help with pain as well. Proper hydration, drinking plenty of fluid. It also reduces muscle cramping. It helps to keep your body function efficiently as it can. So keep in mind that what you're eating, sometimes breads, pasta, pizzas, sodas, anything that can cause inflammation can impact can cause pain. And the best way to check on that is to keep a diary and talk to your doctor if you notice that you have a pattern of pain after you eating something that doesn't go right with you. And then, of course, weight management, which is very big. This is the number 7 tip is weight management because, again, if you're really heavy, it does put strain on your joints, and you might suffer from pain in the knees, the back. Your doctors will speak to you about that. Your BMI, your basal metabolic index can tell you if you're going to be having pain and how to manage your weight so that you'll notice if you lose maybe 20, 30 pounds, your knee pain might go away, your back pain might get better. Again, speak to your primary care physician about that. And, lastly, I again believe in advocating for yourself, talking to your doctors, letting them know what is working, what is not working, and also do not give up. Know that there's a lot of methods, there's other options that you will find that helps you where somebody else may not achieve healing, but you can. So do your research, talk to your doctors, and if you need anything, please put it in the comments, reach out, and we can have a discussion. And again, my name is Nurse Maggie, and I wish you the best of health and have a great day. Bye bye.